And we don't know if the same is true yet for Omicron, but it does appear for some variants, natural immunity is as protective as a vaccine.
Medical reporter Liz Bonus breaks down the research.
Hey there, everybody. Hello to you. Vaccination with prior infection. That was the formula that appeared to be most protective with the Delta variant as it moved through, according to this new research. The CDC does report, however, that prior infection alone may have similar protection, although there's a few caveats to that research about natural immunity protection. Those caveats include that the analysis was conducted prior to the spread of Omicron, before booster doses were widely implemented, and that we don't know how severe those prior cases of infection were in those who did get the virus. Researchers found prior to the Delta variant, those who got infected with the virus most often were those who were unvaccinated. But when Delta came around, it does appear from this research conducted in New York and California, those who had a previous infection were better protected than those who only had a vaccine.
No question about it. If you've had COVID-19, there's protection there.
But Dr. Thomas Lamar told me after caring for patients for nearly 2 years at Ohio's Christ Hospital Health Network, he's seen what this study also found.
The group that appears to be the most immune are those who have had COVID-19 and have been vaccinated.
Because the vaccines were closely matched to the early strains of the virus prior to Delta, when compared to the unvaccinated, those who only got a vaccine had about a 19-fold lower rate of infection. If you got the vaccine with prior infection, you had about a 9-fold lower rate. No vaccine with prior infection had about an 8-fold lower rate. Now watch the switch with the Delta variant. Only a vaccine, up to a 6-fold lower rate. No vaccine but prior infection, up to a 29-fold lower rate. Vaccine plus prior infection, up to 33-fold lower. What to know about all this, however?
The problem with natural immunity is that you have to get sick to get there, and COVID-19 is essentially unpredictable.
And researchers still remind us that in spite of this research, an initial infection among people not vaccinated does raise the risk for serious illness and death from any strain of this virus. I'm medical reporter Liz Bonus. Now back to you.